पॉलिसी बाजार पर 1 करोड़ रुपए का टर्म लाइफ इंश्योरेंस केवल 450 रुपए महीने से शुरू। Wow.
The senior Delhi minister, Raghav, you speak now for 2 states, Punjab as well. So the mask mandate, it's not been prescribed by the centre as yet. But does that mean that, you'll wait for a central notification, or are we headed towards that?
Look, the state of Punjab has issued COVID appropriate behavior guidelines earlier in the day. Both our chief ministers, the Delhi chief minister and Punjab chief minister, have convened meeting vis-a-vis the kind of capacity that we have in terms of number of beds, the oxygen supply, the storage capacity, the oxygen cylinders, cryogenic tankers, and they have essentially gone through the preparedness that the state has been able to sort of, come up with over the last few months and years. However, I do feel that, a strict advisory from the union government must come. I think we must learn from the lessons of, the early on setback that we witnessed in the first and the second wave. And I have just 4 suggestions to make to the union government. And this is something that I tried raising in the parliament also earlier today. One is, to my mind, the air connectivity must be monitored and reviewed, and the government may, if required, consider banning flights that come via China or connecting flights and flight operations of China. Number 2, there must be a mandatory institutional quarantine. I think prevention is better than cure, and we must try and prevent it to the extent possible. Number 3,
mandatory quarantine of international travellers.
Well, of travelers coming from affected regions or countries which are witnessing a surge in these cases, I'm given to understand that it's not just China. A few other Asian countries are also experiencing this new variant. In particular, Japan is witnessing, a new variant. So therefore, institutional quarantine must be certainly reviewed by the government and, if required, certainly enforced. Number 3, I think they must summon a meeting of all virologists and epidemiologists immediately and let them fearlessly put forward their view without any downplaying of this. And fourth point, and very importantly, I think all of us are worried with the news reports and videos that we are seeing that are originating from China. There was a UK report that was just put out by your channel a few minutes ago, which essentially says that, China may even reach 5 million new cases every day in the
5,000 deaths a day is what Bloomberg is saying.
Yeah, and
presently,
so
5,000 deaths a day.
5,000 already, yes. And the number is likely to go up. That's what your report also says. So therefore, I think it's important that my point number 4 is that it's important that the government of India addresses a worried nation. I think all of us are worried. The government of India must certainly address. The health minister today certainly gave a statement in both houses of parliament. That statement was a good beginning. However, I think we need more details and just, rather than just an assurance that all is well. And we must certainly not downplay, on the...
No, but Raghav, are you going to therefore start, in your own capacity, Delhi government, Punjab government, start telling people to control crowds ahead of New Year's? No more no big New Year's gatherings? What about markets?
I think today,
what about schools?
Today, both governments have put out, a statement, including the Chief Minister of Delhi even addressing the media as to what is the level of preparedness that we have as on this day, which was very reassuring. And hard facts and figures were given as to how many cryogenic tankers do we have, how many beds do we have, what is our testing capacity, whether genome sequencing is happening or not. So actual minute details were given to the people of Delhi and Punjab respectively. So that is, of course, very reassuring.
But why are you, Raghav, staying away from suggesting, and I'm not saying that's necessarily the answer, but I'm just trying to ask you, why are you staying away from telling people don't gather in large numbers over the New Year's? Is it?
No,
do you believe we've not gotten to that stage?
No. So both governments are respectively reviewing this, and the moment that is required, the same will be announced without any hesitation. I think me and my party and our governments firmly believe that downplaying the early signs of a new variant can be disastrous.
Right.
And we've seen that. All of us were delayed. We delayed. The government of India delayed ban on international connectivity in the first wave, even in the second wave.
Yeah.
We downplayed the oxygen. I mean, you have the government of India essentially every morning coming before you and saying we have enough oxygen, and yet we saw so many people dying because they couldn't get access to oxygen. So I think we must not downplay. We must ramp up our capacities. Preparedness must be top notch, and prevention is better than cure. This is something I said in Parliament also. Prevention is better than cure. Let's try and prevent to the extent possible. I was listening to, a very senior medical practitioner who you interviewed first. He said that perhaps banning international flights could have been an option, but even then the virus finds its way. I agree, the virus may still penetrate into the country, but it is important that we defer it and ramp up our capacities and preparedness. And this is from what we are reading and whatever I've been reading from writings of several epidemiologists, that this is an essentially a virus that can even penetrate your protection layer of vaccine. This is an immune escape variant.
Yeah, it escapes immunity.
So with the highest level of transmission that one has seen in the recent past. So I think we have reasons to worry. We don't have reasons to panic yet, but reasons to worry and be alert and be aware of what we are going to witness in case we do not prepare.